What type of doctor are you?
An OBGYN.
My name is Marcus Penn. I'm an OBGYN from Annapolis, Maryland also.
And I understand you've been coming to this conference for quite a long time.
Yes, I have, for sure. Yes, I have.
And why?
Because of all the information that you can gather from all the attendees and the teachers, it's a fantastic conference. And I've always left with more pearls than I can handle.
Do you feel the same way?
Absolutely. I think Dr. Penn's not actually missed one at all. He's too humble to tell you that. But yeah, absolutely. I think the first couple of years I was completely overwhelmed by all the videos because I was very new at Da Vinci surgery. And now 10 years in, it just feels wonderful to pick up all the different pearls and you can really absorb it better. And our hospital now has residents. So they were kind enough to let me actually bring our robotic resident here today as well.
So what do you both feel is the most significant plus of being able to do these surgeries robotically?
For me, it's eliminating needing to make an open incision. I can take larger uteruses and patients who are actually larger and convert cases that I would normally have done through vertical or larger transverse incision to a laparoscopic incision. So they get to go home that day and they have quicker recoveries.
Yeah, I agree with Dr. Penn. I also think women run the household. Everyone depends on them. And so it gets them home sooner. They're happy to get back to a quick quality to their life. Their families are as well. And in addition to minimizing incisions, we feel good providing better care that way. I feel it's like technology. We're advancing our own career path and our skill set.
You mentioned, of course, technology continues to change. This is the 15th year, so quite a lot has changed over the last 15 years. What do you think has been most significant in the robotic surgery field and how you're benefiting from it?
I just think the newer procedures, like she talked about the ICG, to help delineate the cavities. We talked about just more difficult cases and how to take care of those. And you can approach those quicker and be able to give people better surgeries, basically.
I was going to say, once you feel that the most significant thing is it makes your ability to do surgery easier and more effective, so you have better outcomes for your patient, and it's better for you both.
Yes, it would be.
Well, it's like golf. We use technology to get better and better and get our game stronger. So I think not only more efficient and effective, but just, don't you think we get more courageous in trying harder cases as well?
Yes, we would. For larger cases, larger uteri, instead of saying, oh, we're going to refer that to someone else, we keep them in-house and take care of them ourselves.
And enjoy this opportunity. We'll work with your fellow colleagues from various hospitals. Some of them are, of course, out of state, coming from all over the United States. Have you felt that by doing that, you've learned more?
Of course, we always get more tips from other people on different things that they do that we haven't been doing, different things that they do at our hospital that we don't have available that we may want to make available at our hospital to take care of our patients better.
What do you both like about the conference the most?
The food. No, I'm kidding. Really just the pearls, the takeaways, and meeting everybody. One of the presenters just now, Asha, I met her 2 years ago at dinner. She remembered it. And it's just nice. We exchanged some pearls, and this year she presented. So it's just wonderful. And I think you guys have someone as far away from Oregon, too, this year.
Well, she is correct. The food is the best food I've ever had at any conference ever. But it's mostly that it's so local and easy for us to get to, and we can get so much information from it.
Can you tell us a little bit about the products, technology you're showcasing here for the docs?
Yeah, so I have here, this is my video tower, my camera head, light source, monitor. This is going to be used in laparoscopic cases. Cameras and scopes over here. Yeah, so this is going to be used in minimally invasive cases, arthroscopic cases, yeah, really anything that you need to use video for.
And how does this type of technology help out the docs?
Obviously, if you can see more, you can do more. We have 4K imaging, and we have a lot of fluorescence imaging, using ICG. helping assess blood flow, identifying the ureters. If they have a good picture, it just makes their jobs a lot easier.
So you've been showing this to some of the different doctors, and okay, and what's their reaction? What are they asking you?
Most, since they just did a lecture on the use of ICG, that's most of the questions I'm getting. So I've been going through all the different modes of this, and everybody's really impressed. And, they didn't know that you could do that with a minimally invasive camera. So it's exciting seeing them so excited about new technology.
So you feel like being part of these conferences helps to drive innovation. They learn from you, you learn from them.
Yeah, absolutely. And they get excited seeing other surgeons speak about it. And then when they get to, some of them are holding the camera in their hands, they were like, I can use this at my facility. So it's definitely worth it.
So what's on the horizon? What's next?
Hopefully more advancements in medicine, hopefully some new cameras and new platforms from Stryker, and I'm particularly excited to see how far we go with fluorescence imaging.
I am here to show the best pain management and closure device called M-Close kit device.
So tell us a little bit about it, the technology that you're showing off to some of the attendees today.
So it's a really unique device. There's nothing else like it really in the market. It's basically designed to address the pain that's being created and to close those deep ports, close with a fascia closure that's very safe. Our needles are fully protected at all times, so it makes it very easy. But in the end, you get to avoid those sharp needles that typically get used to close those deeper ports.
So how does this help the surgeon?
So what happens is that at the end of the case, you're doing robotic cases, you're putting in ports. Typically the 10 or larger ports have to be closed. The deepest layer of the abdominal wall is going to be your fascia. In order to reduce herniation and all those things, typically you have to go in there with something really sharp to close that fascia. And it could be very challenging at times, especially when you have very obese patients. You have to go in with something sharp. Anytime you can reduce entering the abdominal cavity with something sharp, it's probably a good thing. Our device is going to be able to directly address that and at the same time reduce pain.
Do you find by participating in conferences like these, you're able to not only help the surgeons and so forth you're talking to, but maybe you're learning some things that you can apply to your own work?
Oh, absolutely. This is the best way we can get our device seen out there. Obviously, I'm surrounded by a lot of other vendors that have really good devices. I always joke around telling my other counterparts, you guys pretty much use all the devices that make the holes. We're the ones closing it. So everybody's here making holes. I like to close them, so to speak. So we're closing those defects. Is that what we're doing?
So you mentioned, I think, that this helps reduce pain. What are you hearing from the doctors who come up to you? What type of questions are they asking, and what are you learning?
The first thing that they're concerned about is they're going to ask me basically, how does it work? Is it easy? Is it safe? And I actually go ahead and show them the video to kind of walk them across. But the bottom line is that, if you have really obese patients, challenging cases, pretty much anybody in the operative team can do it. Even the youngest resident can do it. And you're going to get exactly the very reproducible and very exact closure because it's symmetrical. So you're going to get exactly the same closure. It doesn't matter who's doing it. Very reproducible.
I understand you're one of our speakers, part of the faculty today's presented. What did you present on?
My first lecture is on myomectomy. I have several other lectures that are coming up, and one of them is tissue extraction. Another one we all do, one of the lectures is challenging cases or difficult cases. And then I've got another one tomorrow on complex large hysterectomies.
Is this your first time speaking here, or have you spoken before?
Several times before. Yeah.
So you have evidently like doing it, and so you keep coming back. How do you think you're being received, and what the attending physicians who are attending the event, how they're reacting?
I mean, I hope they look as engaged as they do from the stage. At least they're nodding and they're smiling at my jokes every once in a while. And then taking pictures of some of the videos and the slides. Usually that means they're pretty, involved with saying, I'll think about what he says. I'll consider that. Or, well, that's a good tip. Or they'll just sit there and kind of wait and not say anything. And then finally at the end, clap at the very least.
So you mentioned you've spoken before, speaking again. Why? Why do you keep coming back, and how do you benefit?
I mean, if Dwight invites me, that's a big honor. So if I'm invited, that means that the attendees filled out their survey and they said it was value added for them. I trained in Baltimore. I like coming back, and I'd like being part of the faculty. I learned every time I come. There's always something new, some little tip that helps me next week in surgery.
What have you learned?
So far, really kind of a affirmation of doing what I normally do. I watched videos and I said, I'd probably do it a little bit different. And then I'll see something. The last one was kind of managing complications, which, thank God I haven't been in that position, but to be prepared for something like that, it made a lot of sense.
So obviously, robotic surgery has changed a lot. This is the 15th year of the conference. Conference 1, Conference 15. We have more to come. What do you think has been like the most significant thing that has happened in robotic surgery, and how you think it's going to continue to impact the field?
I've been doing robotic surgery since it came out, so almost 20 years. And the robotic platform keeps improving. The vision keeps improving. We now have DV5, which has one of those DV5 units has basically 10,000 times the computing power of the old version, which is amazing. And so it kind of is exciting about the future because we've come from so much to stand on, so much foundation and innovation, technology advancement. It just keeps getting better and better and better. So from the robotic surgery world, I mean, the Intuitive Surgical still is by far the leader of the pack. I get to see some of the other robots that are kind of up and coming, and there has yet to be anything that I think has the kind of value where they can enter in and still have the trajectory of getting better, which Intuitive has kind of proven over and over and over.
Dr. Im obviously likes having you as a speaker. What are you bringing to the table that is making that a significant thing for the attendees?
Okay, I think experience and volume, always outcomes measured against experience and volume, passion for the robotic platform. And I've always had a passion for teaching ever since I was younger. I love hearing feedback after the course. Years later, even, people come back, they see me at another event, or they text me pictures of something they just performed that they couldn't have done without the tips and tricks. All those things are really I think that's what kind of keeps us going as instructors, is the feedback and the positive encouragement that we get of affirming our teaching.
Thank you very much, Doctor.
My name is Emma Rossi. I'm a physician. I'm a GYN oncologist at Duke University in Durham.
And I understand you're one of the presenters today. Is that correct?
That's right.
And what were you presenting on?
So I had the opportunity to present on a few different areas. I've just presented on how to manage major hemorrhage or vascular injury. I'll be talking a little bit about radical hysterectomy for cervical cancer, and then managing very complex hysterectomy for large fibroid or atypical location fibroid uteri.
And how did you come to be a member of the faculty today?
I had the great privilege last year of actually being able to speak at the course, and had an incredible time. And fortunately, I got the great privilege again for Dr. Im to ask me to come back again today. And when he asked me, I said absolutely 100%. I found it such a valuable contribution, both for the participants as well as for me, that I couldn't say no.
So when you've been contacted, they want you to come as a speaker. What's the process for you in terms of determining, well, what am I going to speak about and what should be my emphasis?
It's really collaborative with Dr. Im. He takes the feedback from each year's course extremely seriously and looks to see what the attendees liked, what they wanted to see more of. And then he collaborates with us about what are our areas of interest and what would we like to speak to. He really wants to focus on demonstrating videos of surgery, so it's not just boring lectures. And so some of that also involves asking, what do we have videos that we can demonstrate? And so together, using that feedback from the prior courses, as well as our own ideas about where we have skills and knowledge, we kind of combine together to develop a sort of a robust curriculum.
And what kind of feedback have you gotten from the attendees? What do they think about what you had to say?
Well, my last lecture was on vascular injury, which is a very high stress, high stakes situation. And so a lot of them, fortunately, have not personally experienced it, but appreciated the ability to see when it has happened to others and how they can start to mentally prepare and think about what they would like to do in a similar situation should it happen. And I think actually a couple mentioned to me that they're going to try to set up something in their own institution where they can simulate or practice with drills what they might do in an emergency situation like that. So that's really great feedback to hear. I'm glad that people took something away from it for an event that hopefully will never happen for them. But I think feeling prepared when it does happen makes you a more confident surgeon, and that's good for your patients.
As a member of the faculty, you're helping to teach these physicians maybe something new that they weren't aware of. What are you learning?
Oh my goodness, I've learned so much already. It's a little bit, that's the dirty secret, is that the faculty, we have the opportunity to present, but we learn just as much as the attendees from our co-faculty, or even just from watching our own videos and having to think about how to teach from our own videos. But in particular, I've learned a lot of information about how to manage complex fibroids with myomectomy and safe methods of tissue extraction. It's a really important issue for oncologists because we're concerned about cancer spread when we remove tissue through small incisions. And so I've learned some incredible tips and tricks from my colleagues on faculty here today, and look forward to being able to apply them and think more intentionally about the choreography of that when I'm operating next time.
Thank you for watching. I hope you enjoyed this opportunity to explore the topic of robotic-assisted surgery with Dr. Dwight Im and his colleagues at the 15th Annual Gynecologic Robotic Surgery Conference as your guide. To learn more about Dr. Im and his work, please visit Mercy online at www.mdmercy.com, and be sure to check out Mercy Medical Center on YouTube at MMC Baltimore. Thank you again, and until we gather once more, may the road rise up to meet you.